Welcome to our event presented by the Cape Community Practice and CanFASD. My name is Amanda, and I'll be introducing and moderating today's session. The topic of today's webinar is Let's Act, Bill S-234 and National FASD Framework. Please note the views and opinions expressed as part of this presentation are those of the presenters and do not necessarily represent those of our funders or other organizations acknowledged. And I just want to welcome any of the folks from the CanFASD network who are joining us today as part of our co-presentation. So on to our keynote speaker today. Senator Mohamed-Iqbal Ravalia was appointed to the Senate in 2018 and represents the province of Newfoundland and Labrador. He is a respected physician and medical educator who immigrated to Canada in 1984 and practiced family medicine in Twillingate, Newfoundland until his appointment to the Senate. He has received a number of awards, including the Order of Canada, Canadian Family Physician of the Year, and several community teaching awards. Senator Ravalia has a focus on rurality, disenfranchised populations, and health needs, and is the Senate representative of the Parliamentary Health Research Caucus. As an immigrant from a minority population group, his experience enhances his perspective as a senator. And he is the sponsor of the bill we are going to be speaking about today. So I'm going to turn it over to Senator Ravalia here. And I think we're having maybe some technical issues. So you may not see the senator, but you will be hearing him. So thank you very much for joining us today, Senator.
Thank you so much, Amanda, and thank you to everyone who has joined us today. I'm delighted and honored to be having this opportunity to discuss a topic that's very near and dear to my heart. Let me begin by acknowledging the terrible tragedy in Tumbler Ridge yesterday, and for us to take a moment to pause to think about all the families and loved ones of those who lost their lives, as well as those who were injured. It's just very difficult to comprehend, and my heart truly goes out to everyone, and to thank the first responders who were there on the scene. I'd like to thank both the CanFASD Research Network and CAPE for their support and advice as I've worked through this bill with my team. And as many of you may be aware, it was initially introduced in the Parliament, and we got right through to the committee stage before, unfortunately, Parliament was prorogued and then an election was called. And unfortunately, when that happens on the Hill, everything the clock is reset and goes back to zero. And so the bill was reintroduced in the current Parliament. It is now in the queue to be discussed at the committee level. And having previously gone through the committee level, I feel very comfortable that should not be an issue. It will then leave the Senate and head to the House of Commons, where we've been working with our partners to guide it through the process in the House of Commons. Prior to it becoming a bill. In my clinical practice, neurodevelopment issues and neurodevelopment complexities were always a huge concern for me for a number of reasons. One of the key ones being that based in a rural community, access was extremely difficult, and the ability to have comprehensive multidisciplinary assessments was very, very fragmented, not only in my province, but I think right across the country. So after sitting down and talking to a number of stakeholders, we decided that the best way to approach this was to develop a national framework that in essence standardizes diagnostic guidelines, improves data collection across the country, and increases public and professional awareness of fetal alcohol spectrum disorder. The express intention, therefore, was to work with provinces, territories, and stakeholders like yourselves to work closely with self-advocates and, of course, to partner with Indigenous communities. The actionable measures of the bill are to direct the Minister of Health to create a framework that includes best practices for diagnosis and intervention, and to improve support for families and caregivers. It's important to recognize that we are responding to the needs of almost 1.5 million Canadians. And the feedback that we've had in numerous meetings is that this bill is particularly important, not only to the community, but potentially sets up a foundational element for subsequent bills that could include other developmental disorders, and through the Health Research Caucus, for us to continue to keep this as a hot burner item in terms of partnerships that have been established nationally and internationally. So I'll pause at this point and happily take some questions. That's a very, very good question, and we've been asked this question on a number of occasions. I think what we would like to see is some direct support giver funding, including potential tax benefits, but also on a more sort of larger scale, availing of funding directly through transfer payments that are dedicated towards individuals who have FASD, but as well as neurodevelopmental disorders. So it would include conversations between the Minister of Health and federal and provincial territorial partnerships to ensure that we minimize the risks of caregiver burnout and that we recognize families and others who are so intimately involved in providing the necessary supports to afford individuals an equal opportunity at becoming productive members of society. Unfortunately, everything is wiped out. However, important briefs like yours and feedback that we've had from other individuals and those who have appeared at the committee level are taken into consideration from my perspective. But we will certainly make a note of assuring that the committee is aware that you would be interested as appearing as a witness. But we'd also appreciate you forwarding the brief through to the committee again, and I apologize for that, but this is just one of these complexities of the way the machine of government works. So I think public awareness is a critical piece. So, reach out to your members of parliament, reach out to your provincial advocates, write letters to the Minister of Health, and forward information to me as well, and I will make sure that through my office we can direct it to the appropriate channels. This has to be kind of a community-wide, country-wide approach. I'm still astonished at the lack of awareness that exists out there, and we have, I believe, and I hope, an opportunity to bring forth awareness across the board from, families and individuals who I feel have been significantly marginalized by the lack of supports and lack of assessment pathways, to actually bring this into the Canadian consciousness. I think the national conferences as well have been very helpful in terms of the feedback that I've received from participants who've kind of been able to get engaged at that level. And then the importance of, recognizing September the 9th as International FASD Day. I've been delighted to see many cities and provinces actually highlight these on social media, and awareness kind of rallies and so on taking place. So it's just important that we continue to keep the momentum going.
Just a comment in the chat, some comments of support. Speaking as a parent of a child with FASD, and FASD educator, peer supporter, and advocate, I'd also like to know what we can do at the ground level to support this bill and help to move it along. My experience is that there hasn't been enough of a coordinated effort. There's not been much information awareness about the bill or calls to action. We've come so far. Let's see it to the end.
Yeah, no, absolutely fair. I appreciate the work that CanFASD have done in this And I think the recommendations that you'll be making, Amanda, in what follows from my portion of this discussion will be very, very helpful. But I want to express my gratitude to the families who work so hard and so diligently to do their best. Patrick Brazo and I have had numerous conversations about this. We recognize how intimately the two bills are woven together, but the mandates are somewhat slightly separate. So from a technical viewpoint, it would not be possible to combine them and present them as a joint bill. But our feeling is that if both bills are able to get through, that there's an increased chance for both awareness and education, and some of the critical pieces of Bill S-202, which Patrick is supporting in terms of the cancer-related risks as well of alcohol intake. So there will undoubtedly be close liaison. We will, diligently, our staff will work together, but the bills will come separately for the reasons I've just outlined.
Okay, I have another question that was asked. From my understanding, if this bill passes, what would follow is the development of a national framework setting standards on diagnosis, support, and prevention. How would that look? Would it be standards for all clinics to adhere to, or more funding towards support? Question mark.
I think it would be a combination of the two. I think we've lacked a national strategy, so it's been extremely patchwork. Access has been a huge issue, and a national framework would force the Minister of Health to dialogue with provincial partners, recognizing that health falls under provincial jurisdiction. But similar bills in autism, a national diabetes strategy, COPD, etc., have actually proven to be an important catalyst for establishing a national, well-established process with guidelines and parameters that afford data collection and afford important diagnostic guidelines, as well as setting up clinics that are multidisciplinary.
Another question, wondering about the evidence gathering process for this bill as it moves into the committee stage. I'm specifically curious about if and how the lived experience of people with FASD in particular, as well as that of caregivers and others with lived experience, is gathered and mobilized to inform the bill's priorities, outlines, actions, and desired objectives.
So in the previous iteration, that was a critical and very important element. And I'm delighted to say that one of my key supporters for the bill was Senator Dan Christmas, who has had lived experience, and he will be a witness, and he continues to dialogue with us and supports us. When I talked earlier about stakeholders, the lived experience piece is the most critical, in my opinion. And having had clinical experience in this arena, I've always felt that we have in our medical system oftentimes an inability to partner in a much more cohesive and responsive way with those who've had lived experience. So this will be one of the critical elements that we will attempt to address.
Comment in the chat. I hope it's included that FASD is significantly higher in prevalence than ASD when you combine the two diagnoses. Among others, the FASD really complicates. So more a comment there.
Yeah, no, and that's a very pertinent comment, and I thank you for that.
Well, thank you, Senator Ravalia, for joining us. I know you have another engagement, so have to go shortly. And thank you to everyone for asking those very thoughtful questions. And I think there may be some more answers for folks from Kathy and Nancy as we move on to the panel portion of our presentation today. So thanks everyone for participating, and thank you, Senator, for joining us today. Much appreciated.
Yeah. Thank you, Amanda, and thank you, Kathy and Nancy, as well. I look forward to ongoing dialogue. I look forward to the pertinent feedback that comes from the rest of this session, and I'd like to sincerely express my gratitude to everyone who's partaking on this very important road that we've all decided to join together and hopefully come out with some very significant positive results. all the very best. Thank you so much.
Yes, you too, and best of luck with the bill. We'll be watching it closely and supporting it however we can.
Thank you. Bye-bye.
Bye. So we're going to move on to the panel portion of our session today. And I'm going to introduce our panelists. So Nancy Poole is the prevention lead for the CanFASD Research Network, guiding a pan-Canadian network of researchers, service providers, policy analysts, and community-based advocates working on FASD prevention. She is also the director of the Centre of Excellence for Women's Health, a research and knowledge exchange center hosted by BC Women's Hospital and Health Centre in Vancouver. Nancy has a doctorate in education and in 2021 was awarded a Doctor of Laws honoris causa by the Justice Institute of BC in recognition of her contributions to women's health, including trauma-informed practice and the treatment of substance use and addiction. Kathy Unsworth is the newly appointed Executive Director of the Canadian Fetal Alcohol Spectrum Disorder Research Network. She served as the Managing Director before that for over 10 years and has been instrumental in driving forward national initiatives, including development of and advocacy for the National FASD Framework. Kathy is responsible for provincial and federal government relations, working with researchers to translate science into policy, as well as managing the National FASD database. Kathy employs her background in public health and community development to use evidence-based research to inform programs and policies to improve outcomes for those with fetal alcohol spectrum disorder. And I'll be moderating the panel and maybe answering a couple questions from the perspective of, I'll be asking myself questions. That's always fun. I'm going to be speaking a bit to how S-202 has moved through and how we've supported that. Speaking from my role as the communications officer at the Canadian Institute for Substance Use Research at UVic. So I work promoting the work that CSIR does. I also support several projects in communications and knowledge exchange activities, such as the Canadian Alcohol Policy Evaluation and Community of Practice, the Canadian Managed Alcohol Program Study, and CoLab. So we'll get started here. The first question for the panel is, what could this legislation mean for prevention? I think the senator touched on that a little bit, but Nancy, I think this is your wheelhouse.
Never nearly enough in my mind, of course. So you mentioned, Amanda, that I've had the privilege of working with a network of women with a lived experience, community-based service providers, researchers, and very few government policy analysts over a number of years now, where we meet and share information about our work on FASD prevention. We learn together about the evidence from the literature and generally just inspire each other to keep working on this highly stigmatized issue of alcohol and other substance use in pregnancy. And one of the things we've done, we've co-developed in this network a 4-level model of FASD prevention that includes awareness raising and community health promotion, includes brief support for everyone of childbearing years about reproductive health and alcohol use by all health and social care providers. 3, to have supportive community-based wraparound services for women who have alcohol problems and related health and social concerns. And finally, as Julie mentioned earlier, also postpartum support and treatment where needed, and support for early attachment and diagnosis of children in services that are also supporting with the women's health as well. So to me, critical to this bill is advancing how this multi-level model of FASD prevention can actually be realized in Canada, in all communities. So there's a coordinated, compassionate, and evidence-informed and systematic approach to FASD prevention. And I think that could be a key contribution of this national framework. Now, I too submitted a brief that goes on about all the ways in which this could be done and all the elements. But I just wanted to mention three quick things that I think are important for us to be thinking about as we're advancing prevention of FASD in Canada. One thing we need is promotion of alcohol, child welfare, and substance use treatment policies that are equally supportive of women's health and children's health. So I think we need to link up that work. Secondly, I feel like we need to advance research and collaborative action by systems of care that will address the complex influences on women's substance use in pregnancy. And those, range from stress-related influences to structural ones, etc. So it's not a simple just say no kind of thing that we need to put in place to, research and enact. And finally, the thing that really strikes me about the importance of a national framework, and the senator kind of mentioned this a bit, was that I think it can guide the bringing together of representatives of provinces, territories, Indigenous nations, a whole bunch of national and regional organizations, and the Public Health Agency of Canada, Health Canada, Corrections Canada, and other relevant agencies, where understanding and action on FASD prevention can be discussed together and figuring out how we can collectively support FASD prevention. So, all these things I've listed in summary, we need all of the levels happening. But I think this idea of strategic collaboration and policy action are things that we can really amplify with a national framework, as well as the awareness raising and the service provision that we always think about in terms of FASD prevention. So that's my take on what it could do.
Yeah, thank you, Nancy. As always, a very thorough and passionate take. Now, a question for you, Kathy, just kind of turning to the other focuses of the bill in your work. What could this legislation mean for diagnosis, intervention, and support? And I'm just going to turn off the screen share now.
All right, thank you. I opted for no slides, which I'm sort of regretting. So I'm going to speak a little slower, and I'm happy to send points out to anyone who wants them. So shoot me an email if you want, if you're interested in that. So I am joining from Ottawa, which is on the unceded territory of the Algonquin Anishinaabe Territory. And I am going to chat with you about diagnosis, intervention, and supports to families and caregivers, and how that will matter for the national framework. So I always start with a definition, which obviously, if you're joining us, you are invested in FASD, but it is just a good place to start. So a reminder that FASD is one of the most common neurodevelopmental disabilities in the Western world, and yet it remains highly misunderstood. Multifaceted brain and body disability that affects many people in our communities. And so this lack of understanding about the complexities of FASD leads to blaming, shaming, stigma, discrimination, and racism that cause harms to people with FASD and their families. It also leads to people with FASD getting almost no supports or services. And we all need to be more informed, understanding, and supportive of individuals with FASD and their families. And a national FASD framework will make all the difference in making this happen. So right now in Canada, FASD is addressed in very fragmented ways. Prevention, diagnosis, intervention, and supports depend heavily on where you live and who you happen to encounter in the system. Bill S-234 matters because it will create conditions for a coordinated, evidence-based national response, and one that reflects research and living experience. And that already tells us that works. So at CanFASD, we see every day what happens when systems don't line up and what's possible when they do. So I'm going to give a little example of so talking about a youth, and we're going to call her Sarah. And Sarah is bright, verbal, creative, but she struggles with memory, impulse control, emotional regulation, and understanding consequences, all common impacts of FASD. Without a diagnosis, her behaviors are misunderstood. She's labeled defiant. She's suspended repeatedly. She falls behind academically. Her family becomes exhausted trying to navigate systems that don't coordinate. By adolescence, things escalate. Because Sarah struggles with regulation and is highly suggestible, she begins experimenting with substances, not because she's bad, but because her brain processes risk differently and she's trying to cope. Her mental health deteriorates, she disengages from school, conflict at home increases. Without coordinated supports, she leaves home, she experiences housing instability, survival behaviors begin. She steals, not out of criminal intent, but impulsivity and unmet need. And eventually, Sarah gets caught by police and enters the justice system. And here's the critical point. The justice system often does not recognize FASD. Her behavior is interpreted as willful noncompliance. Conditions are imposed that her brain struggles to follow. She cycles deeper into a system that was never designed for her neurodevelopmental needs. Now imagine Sarah with a national framework in place. Prevention efforts reduce stigma and increase awareness in her community. She is diagnosed earlier because national standards and capacity exist. Her school uses FASD-informed approaches. Her family receives coordinated supports. When she struggles with substance, the response is therapeutic, not punitive. And if she does encounter the justice system, screening and diversion programs are informed by FASD research. Instead of a justice trajectory, Sarah has a support trajectory. And that is just one example. So talking about assessment and diagnosis. So a diagnosis is done through a variety of assessments and testing with a multidisciplinary team, and they help identify an individual's strengths and challenges, which allow an individual to set realistic and meaningful goals and expectations for themselves. And diagnosis also connects them to supports and services they need, and appropriate and timely interventions in education, employment, housing, emotional regulation, mental health, and more. And it can mitigate and improve some of the experiences that a person with FASD is having. Above all, diagnosis gives individuals with FASD and their family answers. Caregivers often feel a sense of relief after a diagnosis as they now understand the underlying challenges their child faces. Through diagnosis, they become connected to the broader FASD community with whom they can share their experience and grow their advocacy skills. So with a national framework, there are national standards for FASD supported by consistent training to identify, evaluate, and diagnose the range of physical, mental, and behavioral effects caused by prenatal alcohol exposure. In Canada, these standards are defined by the Canadian Guidelines for Diagnosis of FASD. So the purpose of national standards are to improve accuracy. So we want to reduce misdiagnosis and underdiagnosis of this complex disability. National standards would provide equitable access and ensure that people receive the same quality of diagnostic assessment regardless of where they live. They would facilitate access to specialized interventions and services that improve outcomes for individuals. And because we know early, accurate diagnosis is critical, and would reduce stigma and help reframe the condition as a brain-based disability rather than a behavioral issue. See diagnostic capacity expanded, so children aren't waiting years, so that it doesn't matter where you live. There's a trained multidisciplinary team that can do the FASD assessment and diagnosis and develop a support plan based on strengths and needs. And earlier identification becomes the norm, not the exception. At CanFASD, we support national diagnostic guidelines and workforce development because a diagnosis is a gateway, not a label. Intervention refers to lifelong tailored supports rather than a cure. They're designed to improve developmental, behavioral, and daily functioning outcomes. These evidence-based strategies ideally include early intervention, Therapy, specialized education, target specific neurobehavioral impairments, and build on strengths and support families. So with a national framework, evidence-based interventions are promoted across the lifespan. Education, health, and social services are aligned around FASD-informed practice, and these FASD-informed practices are all evidence-based. Interventions, again, build on strengths while addressing functional needs. CanFASD's role is translating research into real-world practice, making sure interventions are evidence-based and usable, not theoretical. In terms of supports for individuals and caregivers, a national framework would mean families aren't left to navigate systems alone. Caregivers receive education, navigation support, and respite, and services are coordinated rather than crisis-driven. At CanFASD, we hear repeatedly that families don't want more programs. They want systems that work together. So why does all of this matter at a systems level? Without a framework, children like Sarah are too often misunderstood, over-disciplined, and underserved. They end up in situations and systems that don't support them, and they are at risk of experiencing seriously adverse outcomes. With a framework, outcomes improve, costs decrease, and equity increases. And Bill S-234 gives Canada the structure to apply what we already know works. And CanFASD is ready to support that work through research, training, and coordination.
Thanks, Kathy. Yeah, that's I appreciated the example in there to just kind of illustrate what this could look like. That was really helpful. So thank you for that. That was great. So the next question I have on the panel is actually to talk about what we can learn from the experience of S-202, the Alcohol Cancer Warning Label Bill. And I can speak to that a little bit from my perspective, working here at CSER and supporting this bill and encouraging our community of practice to support this bill. I don't know much about I'm learning a lot about the machinations of the Senate and how our government works and all that stuff. So I just want to say I'm not an expert. I'm just speaking from our experience here, supporting this bill and through our community of practice. So we are lucky to have a website called alcoholandhealth.ca, which has a letter writing tool that can target folks in government, both in the House and the Senate, and then other local governments. And so we've been using this tool to generate letters of support for this piece of legislation, and we've had a couple other campaigns as well. And I'm happy to say that we are working towards getting this tool up and running to support this bill. So when that's ready, we will be sharing it with our community of practice and with folks on this call to help people write letters of support. So it's essentially a form letter. I'd say one really key thing that's been helpful in us kind of motivating our community of practice to support S-202 has been an advocate group in the form of the Canadian Cancer Society on S-202, and that's why we're really fortunate to have the CanFASD network as well, because the folks at CCS were really great about they helped us, they drafted the letter, they helped us follow the bill's journey and kept us apprised, as did Senator Brazeau's office. And I'm sure this seems to be very similar to what's happening with this bill, S-234. So that's great. So I just want to say having, an advocacy group like CanFASD who's following the bill and passionate about it, communicating with the Cape COP it's a huge asset, as well as having some communication with the bill sponsor. So what we did was we kind of started our letter writing campaign once the bill once it was scheduled to go to committee, and then we set up our tool to target the senators who were sitting on the committee, so folks could write letters of support to the committee while they were studying the bill. That was really helpful, generated quite a few letters. And then once it passed through committee and went on to third reading in the Senate, where it's kind of sitting right now, waiting to be discussed, hopefully soon, because the Senate is now resumed sitting. We switched gears and made the tool so it targeted all the senators in the Senate, because the Senate is different than the House. You don't have like a senator really, you kind of want to write to everybody. Some of them do represent regions, as we heard from Senator Ravalia. He's in Newfoundland and Labrador. But so we just retooled the tool to send a letter to all 100 odd senators in the Senate. So they're all getting letters. I think we've generated over 300 in total between those two kind of the committee and the wider Senate. So it's been a great success. So I can see, in terms of our support, our community of practices support and the letter writing tool support, I can see it following a similar pathway. So that's exciting. So I'm glad we have those tools at our disposal. We've been able to learn a lot because this bill is following a bit of a different pathway through government than bills normally do. Of course, normally they get introduced in the House and then they move up to the Senate. These ones are kind of moving backwards. So they're starting in the Senate and then hopefully moving into the House to become law. So it's a bit of a different system than legislation normally moves through. But I think there's been a lot of learning, for our community of practice and those of us who support that on how things work. And yeah, so that's sort of my perspective on as someone who's been supporting it, how that's gone. So hopefully that's a bit helpful. And that kind of comes to our last question that I'm going to pose with Nancy and Kathy here is how, and we've heard it a couple times in when Senator Ravalia was speaking, but I think it's important to reiterate this. How can people get involved and support this bill from your perspective at CanFASD?
So go to the CanFASD website. The link is earlier in the chat, but I'll copy and paste it again. We give you some direction, so you can write to the senators using the alcohol and health.ca form letter that will be up shortly. It's not yet there for Bill S-234, but we are drafting the letter and have been kindly, and CAPE has kindly allowed us to use their platform for that. So that is coming. So and we'll let all of our interest holders know when that's available. Go talk to your MP, knock on the door, and tell them how important the framework is, and that they need to support it when it gets to the House.
Yeah, and aside from these, structured, useful ways of getting involved, the senator kind of implied this in some of the things he was saying around how we can all talk to everybody we know about these things being underway and increase awareness and get more and more people involved. And for me, that kind of building of the discussion of alcohol use in pregnancy is really important, to pull it out of those places of stigma and putting it front and center in something that we can all do to support parents and those who are going to be parents around their alcohol use and their children's health. And I think this idea of having these bills, both of them, the ones around labeling and the one around FASD, are really an important moment in Canada for us to be able to discuss this more widely and make it a really something that all Canadians understand.
Thanks. And I will note that, in terms of the synergy between these two bills, after S-202 was studied by committee, one of the observations from the committee was advocating for a pregnancy warning to be added to the legislation. So just another way that these two bills could work together.